occiput. In a small part of the population, there is a suture down the center of the frontal bone. It is possible that this suture helps during the flattening phase of cranial motion. Frontal decompression. The intention of this technique is to free any restrictions between the coronal sutures and to balance any abnormal tensions in the falx cerebri. Use this technique with anyone who has received a blow to the head, has headaches, or where you suspect birth trauma. Start with your client supine. Place your thumbs lateral to the eyebrows. Take out the skin slack as you move your thumbs slightly toward each other. Monitor the cranial rhythm and gently lift the frontal bone up into the sky. This is a very subtle light movement that is executed as you breathe with your client. Your touch will allow her to release tensions held in the frontal bone. The sutures will relax and disengage, allowing more breathing room so that the frontal bone can dance unobstructed and let go of adhesions and trauma. After the sutures have released, you may feel a more elastic resistance caused by the membrane connection. If you notice a tugging sensation against your pressure, just continue to hold until you get a softening and a release. It will feel as if the frontal bone is floating. To assist a client who is feeling physical or emotional strain after doing spiritual practices such as meditation or intense yoga, balance the glabella and bregma. Cradle your client's head in your hand. Make a secure contact at the occiput. Place your other hand lightly over the frontal bone. Your thumb will contact bregma. Your middle finger contacts the glabella or third eye, and your two other fingers will contact the apex of the eyebrows. This contact establishes a good vantage point from which to sense the communication between the occiput and the frontal. You will sense the membrane activity of the falx cerebrum. Hold this contact as you maintain communication with the cranial wave. Use the same technique of waiting, listening, and in training with your client's breath to sense the movement of these bones. The compression is derived from the weight of the occiput and the very light yet secure contact over the frontal bone. Feel the membrane elasticity and the flexion-extension patterns as you feel the occiput bulging in confluence with the sphenoid nosedive. Hold until you sense a still point and a rebalancing of the rhythms. Balance the frontal with the viscerocranium. Place your palms on the frontal bone and allow your fingers to lay over the mandible and zygoma. Just as with the temporal palming, monitor the rhythms and feel the communication between the frontal, the mandible, and the zygoma. Maintain the same conscious awareness as you have had throughout the session. This technique is very soothing and integrating. Lesson 10, the zygoma. The zygoma are located at the corner of the face, here. They are the face we show to the world. There are no direct connections to the reciprocal tension membrane. The zygoma are thought to act as shock absorbers between the motion of the temporals and the maxillae. During flexion, the orbital part of the zygoma rolls anterolaterally, and the tuberosity rolls inferior. Give attention to the zygoma after dental trauma, being hit in the face, or in sinus problems. Zygoma palpation. To restore a balanced cranial rhythm to the zygoma, start by placing your fingertips and thumbs over the zygoma and hold lightly. Quiet down and open up to the subtle motion. This contact is very helpful for sinusitis and frontal headaches. If there is any tension or compression held in the zygoma, they will enjoy this hold and may want to unwind. They may take the cue from your contact to begin moving from side to side. Just keep focusing and feel the zygoma push and pull back and forth as they unwind and balance is restored. Another treatment option is to laterally decompress the zygoma by applying gentle force in a lateral direction, all the while keeping in contact with the cranial wave. Lesson 11, the maxilla. The maxilla are part of the viscerocranium and form parts of the mouth and nostrils. The maxillary sinuses are the largest in the head and can be the source of stubborn sinus infections. The zygoma, palatines, and vomer all connect with the maxilla and help absorb some of the motion of the sphenoid before it reaches the maxilla. The speed-reducing attributes of these bones is analogous to a circuit breaker box, taking the full energy of the power line and making it usable in a household. The movement of facial muscles, the position of the tongue, and the movement of the sphenoid and palatine bones affect the way the maxilla moves. When the sphenoid goes into flexion, the maxilla moves anterior, inferior, and lateral. The maxilla are involved with talking, chewing, and smelling. Interoral technique. The intention for this technique is to free the median palatine suture. This can offer relief for eye socket headaches, cluster headaches, migraines, sinus congestion, and is helpful to those undergoing orthodontic procedures. Always ask permission before doing any work inside the mouth. Sit at the head of the table and put on gloves. Place the 2 index fingers as far back along the surface of the upper teeth as is tolerable for your client. Place your thumbs on the upper lip. Tune into the cranial rhythm and track any movement you feel. After you become familiar with the motion of the maxilla and you notice restriction, follow the movement into the direction of ease. If this is in a lateral direction, reposition your fingertips directly on the maxilla, inside the molars, and apply slight lateral traction. While performing traction, always follow the motion as the bone unwinds. Be patient with this work and let yourself drop into a meditative state. Don't try, just be present with the bone and let it begin to move. When you are complete with this technique, check in with your client. There can frequently be emotional content in jaw disturbances. Lesson 12, the mandible. The mandible is the most actively movable bone in the viscerocranium. The temporomandibular joints are right in front of the ears and can easily be felt when the jaw is open. Tension held in the mandible can contribute to headaches, respiratory inhibition, and muscular tension throughout the upper body. To discover this, clench your jaw and notice what other muscle groups tighten in response. The mandible moves in relationship to the temporal bones. The mandible has 16 muscle group attachments, more than any other bone in the body except the scapula. And these muscle attachments can influence the free flow of movement in the mandible. When the mandible is relaxed and open, the rest of the body is more relaxed and open. Hugh Milne, in his book, The Heart of Listening, says that on an energetic level, the mandible is related to identity, aggression, determination, tenacity, sexuality, sensuality, and suppression of tender emotions. It is a very important bone indeed. Palming. Palming is an external technique you can use to release the mandible. Place your palms gently over the mandible, making sure to have a steady contact all the way along the bone. Tune into the cranial rhythm. Your connection to the mandible will be the fulcrum, and the mandible will start to unwind. This contact relaxes tense muscular attachments as well as helps restore motility, and is helpful for emotional calming as well as teeth grinding. When you have sensed a release, gently let go. Interoral technique, 2 hands. For this technique, don gloves. Then gently place your thumbs over the bottom teeth as you contact the mandible externally on both sides. Hold and sense the motion of the teeth. Usually they have a lot to say and will begin unwinding. If this unwinding is not occurring naturally, apply 5 grams of decompressive movement to the teeth, holding them laterally to encourage movement. You will feel the mandible drop slightly out of the joint space and posterior as the restriction is freed up. If your arms get tired during this technique, try the following technique instead. Interoral technique, one hand. Although not as specific as the two-handed technique, the one-handed technique is easier to do. For this technique, use one hand. Place your thumb on the surface of the bottom teeth while holding the mandible bottom with your fingers. It is okay to rest your elbow on the table. Your top hand cradles the parietals. Feel for the unwinding of the mandible. Once you master feeling the mandible, tune into the motion of the parietals at the same time to feel the entire cranial complex move. The technique is complete when you feel a release. Remember that this can take anywhere from 2 to 20 minutes. Lesson 13, the deeper rhythms. As you develop your skills and cultivate presence in your work with clients, your palpatory abilities will become more sensitive to the sensations you perceive under your hands. There are several levels of awareness that you can attune yourself to in your practice of craniosacral technique. The cranial rhythmic impulse, which operates at a varying rhythm of 6 to 14 cycles per minute, is the fastest rhythm that you will perceive. This rhythm varies in response to the autonomic nervous system activity within the cerebrospinal fluid and the tissues of the body. The calmer we are and the less stress we are experiencing, the slower this cranial rhythmic impulse is. Think of these rhythms as oceanic movement. The closer we are to shore, the more activity there is. The waves that break on the shore have a varied rhythm and intensity, depending on the weather and the moon cycles. The further we move out into deep ocean, the slower and more regular are the movements of the fluids. The biomechanical model of craniosacral work that is taught by Dr. Upledger, Hugh Milne, and many osteopaths focuses primarily on this cranial rhythmic impulse. The biodynamic model, which is taught by Roland Becker, James Jellis, and Franklin Sills, focuses on the slower, longer fluid tides in the body. The potency tide, which is a deeper expression of the breath of life, or primary respiration, has a cycle of 2.5 cycles per minute. There is an inhalation phase that lasts for 12 seconds and an exhalation phase that lasts for 12 seconds. Slower than this fluid tide is the long tide that occurs every 100 seconds. So we have a 50-second inhalation phase and a 50-second exhalation phase. Underneath this long tide is a dynamic stillness that is a deep expression of the breath of life. This movement is like a groundswell that has no particular timing. It is simply life force and can be felt when the practitioner is in an expanded state of stillness that comes from being deeply attuned to the midline, that state of neutrality that is the matrix for spiritual experience. Just as in life, we can attune ourselves to varying vibrations. When our mind is moving quickly and is easily distracted, we are not able to tune into the cranial rhythm. When we quiet down a little and center ourselves, the rhythm comes into our perceptual field. The quieter we get, the more we are able to tune into the deeper fluid tides. Becoming proficient in craniosacral work involves a deep commitment to cultivating your own deep stillness. The rewards for this commitment are limitless and involve deep healing for yourself and all the people you touch with your awareness and with your hands.